So one of the big challenges whenever you're working with patients or working with family members that struggle with addiction is denial. Denial is also indispensably part of the illness, because in 8 years of doing this and thousands of patients, I've never met one person who could say, I'm proud of my addiction, not one. And because of that, the opposite, unfortunately, is often the case. They're actually quite ashamed of it. So denial is a natural defense mechanism whenever you have a behavior or an activity or a thing that is associated with you that you're ashamed of. Addressing that denial is very challenging and very emotionally charged. And I think the first thing that you have to do is you have to depersonalize their denial. This is not a reflection of them. This is not a reflection of you and their relationship, but rather this is a reflection of the pathology. And again, when we mentioned accepting the fact that the addictive pathology is irrational and illogical, you have to accept that their denial is irrational and illogical, because they will sometimes be actively engaged in substance use and come up with an excuse or a denial right before your eyes. And it's not, you have to resist the temptation to presume that it's because they think you're stupid. It's not that. It's that their mind recognizes that they are engaging in a behavior that is unhealthy and toxic, and it is trying to come up with every excuse to normalize the behavior. The best response, and it's not always effective, but honestly the best response, because it helps to build a relationship instead of destroy a relationship, is essentially reiterate to them in some form or fashion that's appropriate for the relationship that you have with them. I love you, I respect you, I disagree with your behavior, I want to help you when you're ready to be helped. I'm not going to condone it, I'm not going to facilitate it, and I want you to know I'm really worried about you because of X, Y, and Z. I'm worried about you drinking and driving. I'm worried about HIV and hepatitis. I'm worried about you not being able to take care of your children. In the case of medical professionals, I'm worried about you using and taking care of patients and hurting somebody. It's not, the more you blame, the more angry and emotional of a response you have, the more damage you do to any therapeutic advantage you have with your relationship. When I'm treating patients and I have someone who's particularly acting out or almost seemingly trying to purposefully be frustrating, the first thing I tell them is like, this is not a disrespectful thing. You're an adult. You know what's expected of you. And we have to figure out a way for you to meet those expectations. I want to know what I can do to help you. I want to know what I can do to facilitate it. But if you're going to continue this behavior, I can't help you. I want to help you, and I'm here when you're ready to change your behavior and when you're ready to talk about it, but I can't be a part of it, and I definitely don't condone this behavior, because at the end of the day, you know the consequences that are going to come from it, from as horrible as death to less horrible but still severe, like imprisonment, losing your children. You have to respond logically, and you have to respond with reason, but also accept that they will be illogical and unreasonable. But you have to repeat over and over with reason and with logic and with compassion. It's easier said than done, but the biggest mistake you can make is getting angry, because if you do have any therapeutic advantage in your relationship, i.e. they love or respect you, or they listen to you, or they trust you, you damage that love, that trust, that respect, and you can't repair that, especially when they're in the throes of addiction. The best option you have is to take care of that love and respect and that therapeutic advantage that you have in that relationship, and answer their unreasonable behavior with reason and with love and with compassion and patience.